Namaste, my dear brothers and sisters. The love and blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram Delhi branch. Once I read a book on electronics, and it said that it was a popular book on electronics, and said that the author in the preface said that I can't exactly promise that reading this book will be a pleasure, but I can guarantee it will be painless. And that is as much of a guarantee as any dentist can give. Things have changed. Visits to dentists are not necessarily very painful, and therefore, but all the same, we can understand because both the toothache and a visit to a dentist is something that we all dread because both can be very agonizing. With that little introduction, let's turn to the PowerPoint. Today it will be a short session, not because there's not enough to talk about teeth, but because I don't know enough about teeth. But all the same, I think we'll be able to share something meaningful in this session. The composition of marble is not very different from that of teeth. And therefore, the hardness and the whiteness which they both have is more than a coincidence. This session is a part of the Yes.03 course on health sciences and yoga, which, along with the other activities of the Yes project, is a part of the 150th birth anniversary of Sri Aurobindo and the 75th anniversary of India's independence. This is a highly simplified picture of a tooth. What we see outside is the crown, and the crown is essentially enamel. Enamel is a very hard substance. Around 70% of it is the hard calcium salts, the type that we find also in bone, but enamel is even harder than bone, more calcium, more of that concrete, and which is essential because of the function that the teeth have to perform. The crown covers another hard substance, dentine. Dentine is even harder than enamel. Dentine is the hardest substance in the body. Around 95% of it's full of calcium salts, which are the hard rocky material, which imparts hardness to dentine. And but this structure should also have a blood supply, and that comes through a little hole at the bottom of this, and that is where the not only the arteries and the veins can enter or leave, but also that is the place where the nerves can enter and leave. And it's because this area also has an innervation that we feel pain. The tooth is embedded in a socket, a bony socket. So in a way, the junction between the tooth and the bone in which it is embedded is also a joint, but it's an immovable joint. And normally it's not supposed to move except when the teeth become loose. So this is the bone in which it is embedded. And once again, to make it firm, there is a ligament here. And this entire thing which is embedded, in fact, the foundation, one might say, of the building or the structure is very deep, much deeper than what we see outside. And it has to be deep because it has to hold on, and it's subjected to so much of pressure and trauma, uh, and therefore we need that deep foundation, the socket in which it is embedded, and this firm joint at which no movement is possible. It's an immobile joint. This is a little more detailed view of the same. This is the crown made up of enamel and dentine, and then we find this fleshy thing uh, surrounding the teeth at the junction of the teeth and the rest of the mouth, and these are the gums. And then this is the bone and the ligament. Now, here at the base, we have these arteries and the veins and the nerves. This yellow is the nerve. And in some teeth, we have not one, but two or three roots of this type. That makes it still more firm. And this is what we have at the teeth towards the back, which are stronger than the teeth in the front. We may have two or three such roots going down, and each of them will have some blood vessels and nerves coming and leaving. Uh, it's narrow at the base, but at the top it widens and it's filled with what we call pulp. And this little narrow passage, uh, which takes it from this hole up to the pulp, is the root canal. All this is of great interest to us now because of the root canal therapy having become so common. How do we maintain our teeth in good health? Through dental hygiene. And one of the most important things for that is rinsing the mouth with plain and simple water. And this should be done every time after we eat something because the food that is left behind in the mouth, little bit is sure to be left behind in the spaces between the teeth, at the junctions of the teeth, wherever some space is available, some food is likely to be left behind. And the mouth is full of germs, and these germs ferment this food, and the product of fermentation is acid, and the acid then starts eating into the teeth, and the result is a cavity because the acid can dissolve the enamel. It is pretty resistant to enamel, but all the same, if it is exposed for a long time and frequently, then it can start dissolving this enamel and gradually reach the dentine, and the pit can keep getting deeper and deeper, and that's the cavity. And if this cavity is not taken care of in good time, it can finally burrow through the entire thing, and the cavity can go through enamel, through the dentine, and reach this pulp. And when that happens, uh, that is a rather serious situation, and that is what can give us intense pain also. And that is when root canal therapy also becomes more essential. So long as there's a cavity and it can be filled up with some bonding agent, uh, root canal therapy may not be necessary. But once it enters there, then root canal therapy may become essential. And what if we neglect it still further? Uh, because there are ways of overcoming pain temporarily. Even clove can do it. Suppose we go on neglecting it and just keep taking care of the pain, then it will keep going deeper and eventually start spreading and affect the bone. So, a simple preventive is rinsing the mouth. And this should be done after anything that we eat. And not only after anything that we eat, also after drinking something. Because there are drinks which contain sugar, and sugar is one of the favorites of the germs in the mouth. And some sugar is sure to be left behind after we have taken a sugary drink, and the germs can ferment this sugar, produce the acid, which in turn will start dissolving the enamel of the teeth. Suppose you go to a party and drinks are being served and you don't drink. So you say, well, I'll not have a hard drink, I'll have just a fruit juice. Now, most fruit juices are a very little of real fruit juice or fruit. Uh, Much of it is water and sugar. And for social reasons, you may not gulp it down. You keep having it a little bit at a time, and the glass may last for half an hour, and then you're offered another glass before the dinner begins, and then you pick up another glass of juice. And the result is that by the time you start eating, you might have consumed two or three glasses of the fruit juice, which is okay. But then for these 2 to 3 hours, the mouth has been continuously full of some sugar, and the teeth are being bathed with this sugar, and the germs will start doing their job. Before you start your dinner, the germs have already started their dinner on the sugar that you are providing. You're ensuring a constant supply of sugar throughout while you're having that fruit juice. And therefore, sometimes you find that if not during the party, but after you come back home and you start brushing your teeth, you find that when the toothbrush touches those raw areas where some of the enamel has been eaten up, you start feeling some pain. You get a painful sensation. So rinsing the mouth is important no matter what we have eaten. Suppose we've eaten just one biscuit. Now, it's not the amount that we've eaten which is important. It is the fact that some food has been left behind which is important. And the longer it stays, the longer the germs get to ferment it. And therefore, the sooner the better, preferably immediately after eating something. Some of the foods are worse than others, those which have sugar and also which tend to stick between the teeth. And the worst culprit in this respect is chocolate. And therefore, after chocolate, even more important, to rinse the mouth. And one can even brush the teeth without toothpaste, just brushing to uh, drive out even that little bit of chocolate which may be left behind if you merely rinse the mouth. So, rinsing the mouth immediately after having something is important. How about hot tea or coffee? Uh, that may also have sugar. And should we rinse the mouth immediately after that? Yes, we can if you have hot water or at least warm water available. But what should not be done is to rinse the mouth with cold water after having hot tea. If that is done, uh, if you rinse the mouth immediately with cold water after having hot tea, that can crack the enamel because, like everything, enamel also expands a bit with heat and shrinks with cold. So if it has been expanding because of the hot tea or coffee, if we rinse the mouth immediately after that with cold water, uh, it will shrink the enamel, and shrinking uh, quickly after it has been expanding for some time can crack the enamel. So, which means that either warm water or for rinsing, or wait for a while till the temperature in the mouth has come down a bit and the enamel is not as expanded as it was while you were having hot tea and coffee. Now, this habit of rinsing the mouth with water immediately after eating something, immediately after a meal, is something which is a part of the Indian culture, and it is commonly, taught at home. But then this is not the way it is in the West, and they very often don't rinse the mouth after this. And this is what Dr. Bhaswati Bhattacharya, who has dabbled in both the world of allopathy and that of Ayurveda, and is that way a unique person. She talks about having migrated to the US. And when she was there studying in a college, uh, sh- she found that all her friends went to the classroom immediately from the cafeteria after eating something. So then she asked her mother that, what should I do? Her mother told her, you can go to the washroom and rinse your mouth before going to the class. And when she did that, some of the other girls who observed her doing that told her that this is rude and dirty. Rude because you should not be spitting in the sink, and dirty because you should not put this water which is in the washroom in your mouth. So it is both rude and dirty. And she stopped rinsing her mouth. And the result was that within a few years, she had a few cavities and she had to visit the dentist. And the dentist told her to floss. She says, my mother never taught me flossing. She told me to rinse the mouth. The dentist taught me flossing. He didn't tell me anything about rinsing the mouth. So that is the contrast. So the do's of India were the not to do's in America. So rinsing the mouth. What else can we do for dental hygiene? After the meals, uh, you know, normally we feel that the meal should end with a dessert, which will leave behind, in fact, a lot of sugar in the mouth. But in Ayurveda, they say that after the meal, you should have something which is katu tiksha kashai, in these categories. That is bitter, astringent, uh, or uh, katu is bitter, tiksha is sharp, pungent, or kashai, astringent. So bitter, pungent, or astringent. That is, and in this category are some things like uh, saunf or fennel, elaichi, cardamom, long, or clove. And again, Dr. Bhattacharya talks about in her book that her father always had hidden in his pocket some cardamom and some clove so that after a meal he could have that. So if you don't have an opportunity to rinse the mouth, there are two things at least one can do. Have some water at the end of the meal. That will do part of the job of rinsing. And then put some of these things in the mouth, and that will take care of because these have antiseptic properties. In contrast with sugar, they'll discourage the growth of germs. What else can we do? Uh, Once a day, datun. Datun, is a stick from trees like neem and babul or kikar. So now these are the types of sticks that have been traditionally used. Most commonly, and perhaps the best, is neem. And right, then we have tooth powders of various types and toothpastes. And when we are brushing, we should brush all the surfaces, particularly taking care of the junction between the gums and the teeth. And with tooth powder, one can massage also the gums. Tooth powder or the datun, one can massage the gums. Now let's come to some of these devices for cleaning the teeth one by one. The traditional datun, and now that the Indian traditions are becoming popular all over the world, we find that this has been commercialized. Uh, One can just get some twigs from a neem tree, and the neem trees are not difficult to find. But then you have these sticks now nicely packed and sometimes in boxes and being sold to your homes by Amazon and Flipkart. That has also started. But leaving that aside, uh, how to use this datun? One of the ways to use it is to wash it, then put it in the mouth and start chewing it. And chewing gives exercise to the jaws, the muscles which move the jaws, they get exercise. And what happens is that the twig gradually at the tip, which is being chewed, keeps getting softer and keeps releasing some juice from the twig, which keeps circulating in the mouth. So there's a fairly prolonged contact between that antiseptic and cleansing juice and the mouth. And at the same time, the jaws are getting exercise. Now, finally, this twig will become very soft at the end and will have fine bristles uh, comparable to a toothbrush. And then one can use it like a toothbrush and just move it around the mouth and then rinse the mouth. So, this is how this twig can be used. And you can see that it has it gives exercise to the jaws and exposes the teeth for a pretty long time, 10 or 15 minutes, to that antiseptic juice. And then you also have brushing possible with the datun. So, in fact, this is excellent. But if this is not possible, then again, Dr. Bhaswati Bhattacharya talks in her book that when they found that the twig was not available and they were sort of caught in there was some sort of a storm going on for some time and they could not go out shopping. What her mother did was to just give them some baking soda, and to that she added a little bit of powdered cinnamon or dalchini, cardamom, elaichi, and clove and long, and that became the tooth powder. So you can improvise a tooth powder. Tooth powders can be improvised. However, if you go to professional Ayurvedic tooth powders, once again, these are not really tooth powders, these two that I have listed here. For example, this trikatu, a combination of ginger, black pepper, and long pepper, is sold more commonly for preventing cold and became very popular during the COVID pandemic. It was being used for both prevention and treatment of the COVID infections. But then it can also be used as a tooth powder. And another common powder, Triphala, which is used more commonly for either constipation or for washing the eyes. If you keep it soaked in overnight in water, the next morning one can use this water to rinse the eye, to wash the eyes. Uh, but Triphala can also be used as a tooth powder. And in fact, if you look at the proper professional Ayurvedic tooth powders, they have many of these ingredients along with a wide variety of other herbs. And which are those other herbs? Here are some of those uh, which are a part of the Ayurvedic tooth powders. And once again, uh, the tooth powder, the composition of tooth powder ideally should not be same throughout the year. There is a certain advantage seen in a seasonal variation in the composition of the tooth powder. So Ayurvedic knowledge is in fact really complex and deep. We may not be able to practice it all the time, but all the same, it sort of creates a great deal of admiration for those who have gone into these details so long back, thousands of years ago, and provided all this guidance. Now, coming to the toothpaste. In contrast with the tooth powders, which have all these ingredients, and all these ingredients are essentially harmless, and therefore, even if you swallow a bit, it doesn't do any harm. In contrast with that, toothpastes, come with that warning, especially the children's toothpaste, that make sure that your child does not swallow the toothpaste. Why? Because what does the toothpaste typically contain? Abrasives, gritty material, which will create friction between the teeth and the powder. And this friction is not very desirable because it will wear out the enamel much faster than it otherwise would. And therefore, there are other components in the toothpaste which prevent this from happening. Now, you might say that same thing might happen also with tooth powder. This is also gritty material. It will create friction between the teeth and this powder, and that can wear out the enamel. To some extent, it is possible, but then if the tooth powder is found fine, then less likely. And what can help is mixing this tooth powder with an oil like mustard oil or til oil, and then rubbing it on the teeth. Now, this will have a double advantage. Firstly, the friction will go down. Once you add oil, then the movement of the finger on the teeth becomes frictionless, essentially frictionless. The friction is gone, so enamel won't be rubbed off. And mustard oil and til oil in themselves have antiseptic properties. And therefore, this is one sort of simple device by which one can take away the abrasive effect of these tooth powders. But then in the toothpaste, this abrasive effect is taken away by things like emulsifiers and binding agents and so on. But what else is there in the toothpaste? Very often they have fluoride. And this fluoride can do a good job in areas where there's a fluoride deficiency in water. To some extent, it can compensate for the fluoride deficiency in water. And fluoride, helps in deposition of calcium in the teeth. And therefore, those who live in these areas which have fluorine deficiency uh, do not have strong teeth. And one can, the teeth are also stained and so on. But so teeth are weak, and this can be corrected by giving fluorine. They're stained actually when there's excess of fluorine, that is fluorosis. So there are areas which have excess fluorine in the soil and the water, and there are areas which have deficient. And in fact, there are very few places in India which really have fluoride deficiency. And therefore, fluoride toothpastes are not really very much called for in India at most places. But then how did this fluoride actually begin? Uh, a little bit of research on the effect of fluoride on improving the deposition of uh, calcium in the teeth uh, was exploited by the industry, the mining industry, which extracted things like aluminium from the ores and mines, and some of the waste sludge from those mines contained fluoride. And this industry was always struggling how to take care of this sludge. And when they found that fluoride is something which can be useful, they exploited this research and sold it to companies which were manufacturing toothpastes. And that's how this fluoride came to be incorporated. So something which was a waste product, which they did not know how to deal with, became a source of income apart from whatever they were earning from the mining industry. So that's how fluoride got introduced in a big way in toothpaste. But now we have reached a state of moderation. Yes, uh, in a certain population, it might do some good, but most of us don't need fluoride in the toothpastes. Now, how about this substance, sodium dodecyl sulfate or lauryl sulfate? This is a foaming detergent, the same type of detergent which you also have in your shampoo. And why is it there? Because it has been found that psychologically, all over the world, people associate foam with a cleansing agent. They feel that if it has foam, it will make the area clean. So, this psychological association between foam and uh, cleanliness is something which has encouraged adding this, because this is what makes the toothpaste, when you use it, create that foam, which gives us a feeling that the teeth are really being cleaned. Then we have these emulsifiers and thickening and binding agents to take away the abrasive effect, and then to make the process of brushing pleasant, flavoring agents and also sweeteners. And sometimes the sweetener may be sugar, which means that you are in fact once again leaving behind some sugar in the mouth, unless you rinse the mouth very thoroughly after brushing, and preservatives so that the toothpaste can last longer. These are some of the things that we have in the toothpaste. And since some of these, uh, if they are, if they enter the body, can be harmful, the children, there's a warning on children's toothpaste that don't make the child should not swallow it. In contrast, you have these all these things which are essentially edible. They are spices, and therefore swallowing will not do any harm. How about Ayurvedic toothpaste? They are a sort of a compromise, because somehow we have got socially conditioned to feeling that toothpaste is superior to tooth powder. And to cater to those who have this, who think so, have come up a large variety of Ayurvedic toothpaste. They are a sort of a compromise. They have many of these components, particularly the foaming agents and sweeteners and flavoring agents, to make the whole experience pleasant. These days there's a lot of emphasis on experience. Even after you've made one phone call, you are asked to give a feedback on your experience. So, to make that experience of brushing the teeth pleasant, sweeteners and uh, flavoring agents are added also to Ayurvedic toothpaste quite often. So, they are a sort of a compromise. And foaming agents to again give the feeling that the mouth is being cleaned because there's so much foam. So, many of these components are there also in Ayurvedic toothpastes. Here's a quote from Dr. Bhaswati Bhattacharya's book, Everyday Ayurveda. There are two kinds of people in the world: those who use tooth powder and those who use toothpaste. Are there some other things that we can do for dental hygiene? In addition to what we have talked about, in addition to either the datun or the tooth powder, is there something else that we can do? Uh, One of the things that can be done, if not every day, I mean, these are some of the things which may not be done every day, but periodically, uh, are oil swishing. Now, what is oil swishing? Uh, or pulling out, or oil pulling. Uh, we keep some oil in the mouth and then move it around from left to right repeatedly. This gives exercise to the muscles of the mouth and the jaws. And also, a lot of things in the mouth are fat soluble. And therefore, uh, the lot of dirt and germs. Germs also have fat soluble, fat miscible membranes. So, because much of our living tissue is made up of lipoprotein membranes, and therefore the result is that if we move it around for a few minutes in the mouth, we find that a lot of dirt and germs and all get pulled out by this oil. And one knows that when it has happened, because the characteristic of the oil keeps changing. And finally, the oil reaches such a state that you cannot keep it in the mouth anymore. You feel like spitting it out. When one reaches that stage, actually spit it out. And this is called kavala in Ayurveda. Another type of practice is gandusha, that is oil holding. This For this one needs to keep a little larger amount of oil in the mouth so that the cheeks are swollen. The cheeks are swollen like this, and then you just keep it there. Don't move it around. Keep it there till you again feel that it doesn't taste like oil anymore, and you feel like spitting it out, and then spit it out. Gandusha can be done purely with oil or also with a mixture of uh, oil and warm water. And some of the oils which can be used for these practices are coconut oil, which will be suitable only in summers because in winters it solidifies, and sesame oil or til and ghee. These are some of the fatty substances which can be used for these practices. Gandusha with ghee is particularly helpful in many types of ulcers in the mouth. How did we manage so far? Because many of the devices that we have today are have entered rather late. Human beings have existed for millions of years before that. The first toothbrush came in 1780, the modern toothpaste in the 1800s, the first nylon bristles for toothbrushes in 1938, the first fluoride toothpaste in the 1950s, and electric toothbrush was first marketed in the US in the 1960s. Some of the foods that should be avoided for keeping the teeth healthy are sugar, which we have talked about quite a bit, carbonated drinks. Again, they have acid, phosphoric acid, and that can dissolve. That dissolves the enamel. Any acid dissolves the enamel. And sour foods, again, acid. Potato wafers, chocolate sticks between the teeth. Fruit juices have sugar and that can stay in contact with the mouth for a long time if we just keep sipping on the fruit juice for an hour or two. And then tobacco, a component of pan masala and all those things which have become quite popular, and pan, which is consumed quite often at the end of a meal. I'll spend a little more time on tobacco because this pan masala has become very addictive. People get addicted to it in their teens and sometimes, and then the habit continues. Like most things, young people can get away, apparently get away with everything, but 15 to 20 years later, what they come down with is some sort of ulceration in the mouth, which is a precancerous lesion. Most of this time, oral cancer start with a precancerous lesion. If it is caught at that stage, still something may be possible. But then very often it is still neglected. The person is addicted. He continues with the tobacco, but does not actually get any treatment for those proper treatment for those ulcers. He doesn't get them examined properly. Never a biopsy is taken of those precancerous lesions. And the result is very often that finally he's compelled to go to the doctor when there's an oral cancer. Oral cancers are pretty common, and the commonest cause is tobacco, chewing on tobacco. And to detect this type of precancerous lesions and many other things early, cavities also, to detect them early, a regular dental checkup, say once a year, is helpful. Of course, one should find that these checkups should all give us a negative report, all is normal. Huh? It's not that the dental checkup, then what is the use of going for the dental checkup? Just in case there is. But then getting a negative report should be a reason for rejoicing, not a feeling that it was all a waste, I should not have gone. Huh? Everything is normal anyway. That should be a cause of rejoicing, not regretting having gone for the checkup. Sometimes, people are a little disappointed if they find that in a blood report everything is normal, as if they were expecting that at least something should be found. Huh? So a regular checkup helps in detecting these precancerous lesions resulting from tobacco and also the cavity at a very early stage before it needs a root canal and before it affects the bone. What is DMF index? Very often dental health is expressed in terms of the DMF index. DMF index means decayed, missing, and filling. That is how many teeth in the mouth are decaying, that is have cavities, how many teeth are missing, and how many teeth have a filling. And ideally, a person throughout life can have a DMF index of 0. Now, what is root canal therapy? Root canal therapy is done for pulp exposure. You know, normally the pulp is not exposed to the outside, but if the pulp gets exposed to the outside and therefore becomes prone to infection, which means if the cavity has gone deep like this and the pulp is exposed, then the infection And one will keep getting repeated infection, repeated pain, and that cannot be really corrected by just having a filling here. So it's done for pulp exposure, and maybe due to a deep cavity, but could sometimes be also because of gum disease. We should not neglect the gums. In fact, the gums are very important. When we are using uh, a tooth powder or datun or anything, one should not neglect the gums, particularly the junction between the gums and the teeth. Gum disease is a risk factor not only for a severe infection of the tooth, but also for many systemic diseases like heart disease and uh, so on. So, gum disease or trauma. Sometimes, if one falls or uh, there's a trauma to the tooth breaks, that can also lead to a pulp exposure. Tooth breaks or there's a crack in the tooth. And the trauma can be not just because of a fall, the trauma can also be because of biting something very hard. Particularly in old age, when the teeth get weaker, biting something very hard can also break a tooth or crack a tooth. And a crack in a tooth is just as like a fracture in a bone. And that also needs treatment, and sometimes it may lead to the exposure of the pulp. What is done during the root canal therapy is that a hole is made in the tooth through which the doctor can suck out the pulp, pulp tissue is removed, and then the root canals are all filed out, that is all cleaned, and then irrigated, uh, which means washed out, rinsed, made clean, and maybe with a medicated substance, and then the whole thing is sealed. Then the opening is sealed so that this whole thing has been cleaned up, filled with some artificial material, medicated, and then there's a sealing here. Now, teeth are a part of the body, they're not an island unto themselves. Periodontitis is the inflammation of the tissues around the teeth, the gums, and it's a constant potential source of infection and has been considered as a separate risk factor for some cardiovascular, respiratory, endocrine, musculoskeletal, and reproductive system related abnormalities. This straight away sort of copied from the abstract of this paper. The reference is here. There has been a lot of commercialization in dentistry. There have been many advances also. Unlike the older dentists who mainly were busy with either extractions or fillings, now the emphasis is on saving the tooth. And the root canal therapy is one of those procedures which helps in saving the teeth quite often. Of course, cynics have remarked that there can be successful root canals and there can be unsuccessful root canals. And successful root canals are those where they were not strictly necessary, where a root canal was not strictly necessary. But all the same, the fact is that they have done quite a bit of good. But perhaps uh, all the root canals that are done are not always necessary. Perhaps that would be a more moderate and realistic way of looking at it. That root canals do help. Some of them can be unsuccessful. Some of them can be successful, as with any medical procedure. But the number of root canals being done is probably more than is strictly necessary. But having said that, and the possibilities of saving the tooth and providing implants, etc., all those things uh, has uh, changed the very face of dentistry. But then along with that has come something else. If you go to the net, you'll find that there are so many dental clinics which they are advertising themselves as places which will give you a smile. They can design your smile. There are computer-based algorithms for what particular uh, type of arrangement of teeth is conducive to giving the best smile, and then the teeth can be rearranged for you to give you that type of thing, and that can be individualized. Person with this sized mouth, this type of a face, what is the type of smile that will be the best looking for this person, and then the teeth can be rearranged to give you that type of a smile. So the smiles are being designed. Now what one is forgetting is that the whole emphasis is on the outside, on the form. No matter what the dentition is like, and what the face is like, if the joy is this joy in the heart, one can give a very attractive smile. Uh, just look at the smile of a child who has not yet got its teeth. A toothless smile can be more bewitching and enchanting than the best smile with all the teeth. In the same way, the smile of a toothless granny can be very affectionate and attractive. So, the whole emphasis on form, on what is visible outside, and are neglecting that this is something which should come from within. It's not the smile that should create joy, it should be joy which should create the smile. The cause and the effect is all reversed, and there is a lot of commercialization for designing your smile so that you'll look better, your smile will look better. Gratitude for the pictures, many of the pictures, and the learning to this wonderful book by Tortora. The co author has been changing in different editions, Principles of Anatomy and Physiology. And then these two books I found very useful, Everyday Ayurveda by Dr. Bhaswati Bhattacharya. It's not only on teeth, but uh, it's about the Dincharya, the Ayurvedic Dincharya. And in this popular book, in the popular science series of the National Book Trust, Dental and Oral Health for All by Abhijit Kulkarni. This again a good book uh, published by the National Book Trust India. If you have any questions or comments, please don't hesitate to drop an email to us at yes@yesspirituality.com. Gratitude to the Mother and Sri Aurobindo for making these sessions possible. And thank you all for being there.
So we can close today's session with a moment of silence. Thank you, everyone.